So I spoke with some brand new perioperative nurses yesterday, and they told me a lot about what they're feeling. I asked them what their aspirations were, of course, but what they're feeling right now in the program about a month in. And it was very interesting because even though they had more observation days than I remember having this early in the program, they were still confused about their job description. One of them was worried about knowing whether or not she would fit into the system or whether or not she should get out, because we only have about 2 months to decide whether or not you'll stay in the residency and have the 3-year contract after you finish. And somebody else said they didn't realize what all their job duties were and they were really concerned about charting, which is so funny because any job you start will tell you, especially nursing, will tell you that if you didn't chart it, it wasn't done, and charting is so important, blah, blah, blah. And then when you get into the room, a lot of preceptors will tell you don't worry about the charting. It comes second nature as soon as you have done it a few times, you get in the rhythm and the routine, and it's not a big deal. But it feels like a huge deal when you don't have your routine, when you're so new and you don't understand what you're doing yet. So, for them, I wrote out a little checklist, which is basically the way the intra-op tab works for our EPIC documentation for the intra-op section. Now, this doesn't help any other nurse. It doesn't help any other person except for a Parkland perioperative nurse. But our checklist is very, very simple and very easy, and if you follow it, you'll do fine. And there are certain rules and things that we have to chart, and certain things that can only be charted once you've spoken to the patient, and certain things that you can quote-unquote pre-chart because it'll never change unless you change the room or anything like that, and then you'll probably change people too, so they'll have to look back anyway. But I created this list for them, and I'm hoping that it will help allay their fears and anxiety about what their job description is, because really, honestly, that's all that I heard, was that they were worried about being able to perform the job and actually liking it, because they hadn't seen exactly what was required of them yet. So bring that back to everything, and a lot of people will tell you to reverse engineer what you want long term to make your short-term goals and to make your action plan for each day. And I know it's difficult because I still struggle with where do I want to ultimately end up, but that's the brunt of it all, is that if you want to be good at your job, you need to know exactly what you need to learn so that you can learn it so you can do it. So it makes sense that they're asking for these things, and it makes sense that as humans we would want to know more and be able to look for more and really create a sense of forward motion, that we know what we're doing and we know where we're going towards and we know how to get there. We just have to get there. We accept time if we make it known and we understand that time is the only factor that won't change, that we can't speed up, we can't slow it down. It'll happen regardless, whatever we do. So just some closing thoughts is figure out what you want to do and go forward with it 100% all in. And if you figure out somewhere along the way that that's not what you want, then change, because life is too short to really not love what you're doing.